Picture this. You're an average American, counting on your health insurance to keep you shielded from hefty bills, especially for something as crucial as a COVID-19 vaccine. But what if I told you that recent changes could flip the script, leaving some folks digging into their wallets? It's a scenario that's got millions wondering about their financial safety net. And trust me, you won't want to miss the twists ahead. For the time being, the majority of Americans with health insurance can still access COVID-19 vaccines without shelling out a dime. That's thanks to long-standing protections under the Affordable Care Act, which ensures that most private insurers cover vaccines endorsed by the U.S. Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, or ACIP, at no extra cost. Even with a new wrinkle added by the CDC, this free access holds strong for many. But here's where it gets controversial. Not everyone might be so lucky, and the debate over who's really obligated to foot the bill is heating up. Let's break it down simply. The CDC recently followed its advisor's guidance and moved away from a blanket recommendation for COVID-19 shots. Instead, individuals now need to chat with a healthcare provider through a process called shared clinical decision-making. Think of it as a personalized check-in where you and your doctor weigh the pros and cons based on your health history, kind of like tailoring a suit to fit just right. No prescription is always required, but this shift aims to make vaccinations more targeted, especially as the pandemic evolves. For beginners, this means it's not a one-size-fits-all approach anymore. It's about deciding what's best for you individually. The big question is whether insurers will still cover the full cost. Under the Affordable Care Act, private plans are generally mandated to cover ACIP-recommended vaccines without copays or deductibles. Medicaid, which serves low-income folks, also ties its no-cost coverage to these recommendations. And Medicare? It's legally required to cover COVID-19 vaccines with zero cost sharing. So seniors and certain others are in the clear regardless. A spokesperson from the U.S. Department of Health and Human Services emphasized that the committee's decision ensures coverage across the board, including through programs like Medicaid, the Children's Health Insurance Program, and even marketplace plans. But, and this is the part most people miss, experts warn that it might not be as straightforward as it sounds. There's a layer of uncertainty creeping in, potentially leading to disputes over who's responsible for the tab. Amy Killalea, an assistant research professor at Georgetown University's Center on Health Insurance Reforms, points out that while the CDC has clarified that shared decision-making recommendations should still qualify under Obamacare's rules, insurers might not all see eye to eye. This ambiguity could mean some plans push back, arguing they're not fully obligated. To make it relatable, imagine you're at a restaurant and the bill arrives. Everyone assumes it's covered, but if the fine print isn't clear, someone might end up paying more than expected. Private plans are overseen by federal agencies like Health and Human Services, Labor, and Treasury, which haven't yet issued specific guidance on this new setup. Meanwhile, at least 13 states have stepped in to mandate that insurers in their jurisdictions keep COVID-19 vaccines free, according to the nonpartisan health policy group KFF. On the flip side, the nation's biggest health insurer trade group, AHIP, formerly America's Health Insurance Plans, representing plans that cover over 200 million Americans, stated that their members will maintain no-cost coverage for all ACIP-recommended vaccines as of September 1st, including the latest COVID-19 updates, through the end of 2026. They stressed a commitment to affordable access, noting that coverage decisions are based on solid scientific evidence. United Healthcare, the country's largest insurer, though not an AHIP member, echoed this, promising full coverage for ACIP-endorsed COVID-19 vaccines starting January 1st in their standard plans, though folks with employer-based policies should double-check with their bosses. They highlighted how vaccines play a key role in protecting communities and urged discussions with providers to assess personal needs. Even Blue Cross Blue Shield plans pledge to cover all committee-recommended vaccines at no cost through next year, adhering to federal and state laws. Yet, here's the controversial angle. Some insurers might now claim they're not required to cover the entire cost of a COVID-19 shot, which typically runs about $140. Kilalia notes there's no strict rule forcing coverage for non-ACIP recommended vaccines, and the shared decision-making label could be interpreted differently. Is this a loophole that prioritizes profits over public health, or a necessary adjustment to focus resources where they're most needed? Medicaid recipients, however, will keep getting the vaccine free, based on prior guidance from the Centers for Medicare and Medicaid Services. And this is the part most people miss. The changes extend beyond COVID-19. The CDC committee also decided against routinely recommending the combined measles, mumps, rubella, and varicella, MMRV, vaccine for kids under age 4. For parents, this means private insurers won't be obligated to cover it without charge, potentially leading to out-of-pocket expenses or even shortages if manufacturers stop producing it. Medicaid and the Children's Health Insurance Program won't automatically cover it either, though states have the option to opt in. The Vaccines for Children program, which helps low-income families, won't include it anymore. On a brighter note, the individual vaccines for measles, mumps, rubella, and varicella, chickenpox, remain fully recommended and covered at no cost, ensuring kids stay protected against these diseases. So, where do you stand on this? Do you think insurers should be held strictly accountable for vaccine costs, even with these shifts? Or is shared decision-making a smarter way to allocate healthcare dollars? Is the MMRV change a step backward for childhood immunizations, or a pragmatic update? Share your thoughts in the comments. Do you agree, disagree, or have a counterpoint? Let's keep the conversation going.